What's up, guys? Dr. Chris Park here, and we got some exciting things coming up, man. Hopefully, January 1st, I'll be in the new clinic. I did a short video showing you the construction zone. It's coming along nice. I think we're going to be real proud of this, okay? The other thing, we got the St. Jude Half Marathon this weekend. I'm going to attempt to run it, It's going to be more like a limp and crawl. I'm just kidding. I can at least walk it, right? I'll try to walk the thing. I've done it multiple times. It's a great cause. You raise money for children who are fighting cancer and other debilitating illnesses. A great hospital system. I'm a big believer in it. St. Jude is my patron saint. I have a child that goes to St. Jude. We really try to support St. Jude and our family. We try to raise money every year. This race is one of the ways we raise money. Now, all right. Moving on, let's get to why you're here. Let's talk about Suboxone. Now, disclaimer, I'm not your doctor. I'm not giving you medical advice. I want you to use this information to take to your doctor to see if it would be an appropriate plan for you. Now, not everybody needs to be tapering, okay? But let's say you have reduced your dose dramatically. You're down to low doses, and now you don't know how to get further. Maybe you got down to 2 milligrams a day, 1 milligram a day, 0.5 milligrams a day, but you feel like you've hit a wall. This is one method that I've used for some folks, is if you can get down to 0.5 milligrams or even just 1 milligram, let's say 1 milligram, but you can't get further, you can add a Butrans patch, which is buprenorphine that slowly releases over time. It's supposed to be kept on for 7 days and changed every 7. The 20 microgram patch is going to give you about somewhere around 0.5 milligrams of buprenorphine a day. So if you're at 1 milligram, can't get any lower, you add the patch. You add it. You don't take away the meds yet. That's going to boost you a little bit. But you're going to add the patch, and then on day 3, you're going to try to get down to 0.5 milligrams on your tablet. Now, okay, you just stay there. Be comfortable. You've basically made kind of a unilateral move. You've gone from 1 milligram a day to 1 milligram a day. So you think, well, where's the progress? Well, it's going to come, okay? But the patch is going to give you kind of a continuous supply of medication, which is going to help with your further dose reductions. But we just got to get level there. So we go from 1 milligram tablet a day to a 0.5 milligram tablet a day with the 20 microgram patch. Now we're at somewhat equivalent doses. From there, you can do one of two things. You can try to get down to, after you've been on this for a month, you can try to get down to 0.25 milligrams on the tablet. If that doesn't work, what I would have you do is probably push your timing out. So go to 0.5 instead of every 24 hours. We're going to go to every 28 hours. You're going to do that until it doesn't feel weird. You don't have any withdrawal. This may take, or you just feel good and comfortable with this. It may take 2 weeks. It may take a month. Then you're going to push it to every 32 hours, okay? If you're doing well with that, then you're going to try to go back to 0.25 milligram tablet and go back to 0.25 every 24 hours, okay? And then you're going to push that timing out every 24 to every 28, every 28 to every 32. You're going to do this in like somewhere between 2 to 4 week blocks, okay? Now, guess what? It might take you longer. Maybe you get to 0.25 and you're like, no, I don't like this. You may need to stay there longer, right? So eventually, though, you're going to be pushing that 0.25 out to where you're taking it every 3 days. And you're still got the patch. So at some point, you're going to bite the bullet and just say, okay, I'm done with the tablet. I'm going to stop. More than likely, you should not have withdrawal, right? Because you got the patch. But I've had some folks still have withdrawal, dropping this minuscule dose and still having buprenorphine in their system. It's crazy, right? I hate that this medicine is so hard to get off of, but it is what it is. So after you've pushed that 0.25 to every 3 days and you're on the patch, and you're feeling stable, you can try to stop the tablet. Now, I usually give my patients something to help them, like some clonidine or maybe Neurontin or something, if I feel like they need something like this to help with some of the withdrawal or anxiety over dropping that dose. Okay? Now, so let's just say we've dropped the dose. Now what? Well, you're on the patch. Well, now they make the patch can be tapered because they make a 20 microgram patch. They make a 15 microgram patch. They make a 10. They make a 5. And so every month you can just work your way down. Now, limitations to this, it's cost, because the patch is expensive, and you're still maybe having to buy tablets. So you've got to have obviously your doctor working with you who is familiar with the patch and familiar with the system and all that. And, the pharmacy, hopefully they won't give you a hard time, because they're not going to understand it. They're not going to understand, why are you on the patch and it's going to blow their minds. But the dosing makes sense. And so if you can explain the dosing to them, then they'll say, oh, okay, well, I get it now. But folks who have never been on this medicine, they don't understand how hard it is to stop, even at the super low doses. But this method gives you a way to get to really small doses of buprenorphine over an stretched out, extended period of time. But it takes kind of being consistent. It takes being, having an idea of exactly what your daily dose is, and not just dosing based on your feelings, right? But actually revolved around true withdrawal symptoms, okay? And also, you gotta be willing to get a little uncomfortable at times. Now, I'm not talking about the severe discomfort of actual withdrawal or anything like that. No, I'm just saying, like, you're going to have to be willing to push yourself a little bit, right? Now, that being said, this whole process, we're talking about it as if there's not an elephant in the room. And that elephant in the room is with relapse. You do not want to relapse. So if you start having cravings to use, or something changes in your life, a huge stressor, you need to figure out what you need to do. In other words, talk to your doctor. Do you need to go back up? Do you need to just stay where you're at for a while? Whatever, because these things are real. And your taper happens in real life, and you've got to be able to roll with the punches, so to speak, and adjust. Again, if your doctor will help you with this, okay? That's what they're there for, all right? So you should not be going through this alone. But I just want you to be aware of that. I do not want you to relapse. It is better to stay on medication than to get off medication and relapse. You understand? What's out there is going to kill you. The fentanyl is going to kill you. All right. Anyway, I don't have to go through that. You're watching the channel. You already know this. I'm preaching to the choir here. So please stay off of drugs. And if you're ready to taper, this might be an appropriate plan for you if you've gotten to super low doses and want to quit, but just can't seem to be able to get any lower than like 1 milligram or 0.5 milligrams. Then this might be a good option for you. All right, guys, I hope that made sense. A lot of rambling on my part. But again, talk to your doctor. Don't take medical advice from the internet. Stay off of drugs, guys. Live your purpose, all right? Go to church, preferably an Orthodox church. Give money to St. Jude Hospital. What else can I tell you? I don't know. Did you notice I'm not drinking coffee? It's because it's late, man, and I've started having to cut my coffee off because I can't sleep at night if I drink it after, in the afternoon, late. Whereas I used to could drink a cup of coffee and go right to bed, but I guess I'm old now. So anyway, all right, guys. Hope you have a great one. Peace.